Hey, this is Dr. Steve. With all the craziness going on with the COVID-19 coronavirus, I mean, it's starting to turn into madness. Even more so every day that's going along this week. I've just been hearing more and more. So I know that there's a lot of people concerned. I just wanted to maybe give a voice of balance, maybe a voice of sanity, hopefully, on things that we can control, because there's a lot of things we can't control. So by the end of the video, I want to give you for sure one or two things that you absolutely can control. So I want to talk really importantly on what you can do, but I want to give you some background, some history on what's happened in the United States in the last 100 years. So a lot of people don't are not familiar with the 1918 Spanish flu epidemic. It's actually a pandemic worldwide. It killed 50 million people. In the United States alone, it killed between 650,000 people to 675,000 people. That was intense. I mean, let me just give you some idea about what was going on. Hospitals were receiving so many people with this 1918 Spanish flu that they actually had to turn people away, meaning that they only had so many beds, and so they wanted to give the beds to people who they could actually help. So the people who they felt were past help, people they couldn't help survive, they had to turn away. And so they only wanted to let people in who they felt they had a chance with. So at that time, 1918, chiropractors were fairly new. 1895 was when chiropractic was discovered. It was in its infancy, really. And so some of these chiropractors, they went to the hospitals and said, what do you have to lose? Let us take care of those people who you have no chance at saving. And so they did that. And what they did, it was actually tremendous response of the immune system to chiropractic at that time. It was amazing. Let me give you some of the statistics so you understand what was happening. So just to give you an idea, when medicine tried to treat these people infected with the Spanish flu, out of 10,000 cases, they lost 950, or about 1 in 10 overall. And so the death rate was quite high. Like I said, 650,000 Americans died from the Spanish flu. That's why they had to shut the doors to most people. So when chiropractors took these people in, they started taking care of them. And here's some of the numbers that we show. Davenport, Iowa, 50 medical doctors treated 4,953 cases and had 274 deaths. In the same city, 150 chiropractors, students as well as practicing chiropractors, treated 1,635 cases with only 1 death. In the state of Iowa, medical doctors treated 93,590 patients with 6,116 deaths, lost 1 in every 15. Whereas also treated by chiropractors and students, 4,735 patients, and lost only 6 people. And so what they were finding was that there was actually, instead of so many people dying, there was a high survivability with chiropractic. And so the question became, well, why are chiropractors having such great results? It's because we focus on drugless methods. And in fact, we focus on helping the body increase its immune system so it can actually fight the flu or whatever you're facing better. Okay, so in these crazy times when there's a lot of kind of madness going on every day, and especially if you're on social media, there's more and more madness every day. What can we do? We can do what's best for our bodies. Number one, hand washing, for sure. Okay, and that's not changed in the last 150 years. Keep hand washing. I recommend it always. But also make sure that you have your spine and nervous system checked. If you're a current patient, awesome, don't change anything. You're already doing it. You're getting the benefits. Your body is functioning at its best. If it's been a while for our patients that have maybe not been in, get checked. It wouldn't hurt to get checked. Make sure you know whether your system is functioning well or not. And then if you're not a current patient, once again, get checked. It's time. Make sure your body has the best ability from the inside to be able to handle whatever you are exposed to. So that's a little history for you. 1918, here we are, 2020. Times are very different, but you know, it's kind of the same. So get checked, take care of your families. I'll see you soon.